Welcome. I'm going to be walking you through my poster titled Genetic Explanation for Increased Risk of Relapse in Patients with PR3 ANCA. The focus of our study was specifically looking at single nucleotide polymorphism, which is upstream of the proteinase 3 gene, and its association in PR3 ANCA, which has been established in prior GWAS studies. But the clinical significance hasn't been fully studied. It's been previously shown to be associated with higher proteinase 3 mRNA expression in healthy patients. Autoantigen expression levels of proteinase 3 are clinically significant. So we use the data from our patient cohort to study the role of this variant in mRNA expression as well as in clinical outcomes. We used patients enrolled in our rare disease cohort and excluded patients with drug-induced or overlap disease. We genotype patients for the G allele, as it's going to be designated of the variant, and we use total leukocyte RNA to measure mRNA level expression using qPCR. We had a total of 401 patients, and the table of patients is shown here. Patients carrying 2 copies of the variant, denoted as GG or homozygous patients, are in this column. CG patients are in the middle column, and non-carriers are over here in the left side. And you can see for the most part there's no significant differences in the group. However, we did find that patients who are homozygous or GG had a younger age at onset of disease, and that's statistically significant. We looked at proteinase 3 and MPO expression in this cohort where we had available samples and compared it to healthy controls. As you can see, proteinase 3 expression is increased in patients compared to healthies, and the G allele seems to have an increased proteinase 3 expression additive effect. So patients with GG had higher than CG than CC. And there's no difference in MPO expression. And to further characterize these patients, we looked at their clinical outcomes, and we found that in non-carriers, there was really no difference between MPO and PR3 in terms of risk of relapse. However, in patients who are carriers of this variant, so the GG or CG patients, there was increased risk of relapse with a hazard ratio of 1.66. So I've shown you that this variant has a clinical impact and that patients are younger at disease onset. The variant is also associated with increased risk of relapse. And I showed you that there is an increased mRNA expression in patients with the variants, presumably leading to increased autoantigen expression. And we postulate that this increased autoantigen expression in the setting of the correct or corresponding ANCAs, so in this case, PR3 ANCAs, leads to increased risk of relapse or more severe clinical phenotype. And so we offer a potential mechanistic explanation for this allele that we studied. It may not be that this variant explains fully the clinical severities that we see in PR3 ANCA. It certainly does implicate the role of autoantigen levels in disease. With that, I welcome any questions via email. Thank you.